So we're going to go over a basic hip flexor stretch here. So one of the most common mistakes that we see in the hip flexor stretch is the lumbar spine gets into excessive extension. So where people think that they're stretching, we're looking to target here, they end up generating the motion from the lumbar spine. So we don't want that to take place. So understand where you're sourcing the movement from first of all, okay? So kneel is set up in a half kneeling position. One of the other common mistakes that we see is when you get into a half kneeling position, the back leg is often turned inward, which puts your hip in external rotation. If the hip is in external rotation, we're going to get away from the hip flexor. So make sure the back leg is in line, the lower leg bone is in line with the upper leg bone. You can actually even slightly internally rotate it to really access that hip flexor even more. Once Neil is set up in the position, he's going to place the stick at 12 o'clock. The bottom of the stick is slightly angled in. He's going to stack the hands. From here at about 40% tension, he's going to push the stick into the floor. He's going to engage the lats. He's going to activate proximal stability through the core. He's then going to take his back foot and he's going to lightly push the foot back down into the floor, and that's going to light up the whole anterior superficial line. Once he's engaged that, he's going to then squeeze the right glute, and he's going to give you a little posterior pelvic tuck. So a posterior pelvic tuck, the bottom of the hip goes forward and the top of the pelvis goes back. All right? And that's where we really start to access that hip flexor. As he does that, he then wants to reflexively or actively take that front leg and try to pull the floor back underneath him, and that'll create more tension in the hips and give you more stretch in the hip flexor. So hold that for 6 to 10 seconds, ease off, and repeat. And there's your basic hip flexor stretch.